I am overwhelmed, friends. That has been quite a morning. I am speechless, and we have got all of our presenters nearly gathered back together here using multiple cameras this morning to try to be able to make the most of our last little bit of time together to squeeze in some Q&A. So we don't have nearly as much time as we thought we would, just because we had so many great presenters here today, and we didn't want anyone to get left out. So let's jump right into some questions. We'll try to go in the order that questions have come in through the chat, matching up with the presentation order this morning. So we'll see how we do. I think this one might be directed towards Dr. Korthus or Kelsey. I'm not sure who would like to handle this, but where do we advise folks to go to get fentanyl test strips? Who feels like answering that one?
I'll start off by saying that all of the syringe exchange programs in the Portland area, and I think outside of that, offer them to our participants. And people can also order them online. I don't know, Haven or Justine, if you want to run through that list again that you mentioned.
Yeah, sure. So you can order them directly from the company that makes them. So BTNX is the most common and most widely used fentanyl test strips. You do have to buy boxes of 100 through them. If you're looking for smaller quantities, Dance Safe, which is a drug checking organization, they sell them in smaller quantities. You do pay more in smaller quantities per strip, so just keeping that in mind.
Excellent. And I had somebody with a Washington County question. I don't know if anyone is familiar with that territory real well, but somebody said, is there only the one syringe exchange that you're aware of in Washington County? That's all that this person had come across? And if so, are there any ideas how to get more out there?
So Washington County does only have the one site right now in Hillsborough near Dairy Creek Park. They are looking at exploring and expanding. They work with HIV Alliance to offer those services. So that's the primary one right now. They are looking to expand. I think it's finding a site and having the staffing and resources to do it coming off a pandemic year. So more to come, I'm sure.
Okay. And I would throw this out to anybody on here, because I think it's some folks were asking about Portland street medicine, and if any of the organizations that you folks represent have got good partnerships with them. Just curious.
I don't want to dominate, but Multnomah County has been partnering with Portland Street Medicine more and more to offer testing. We provided them with some nasal Narcan to distribute, because we recognize that they're working with a lot of people that maybe not accessing harm reduction services directly. So there is more partnership happening there.
Excellent. And I believe this question was for during Haven and Justine's segment, so I hope I'm aligning that where it should go here. But I believe you were speaking about when folks want to get their records changed or expunged. How do they pay for those costs to make that happen?
That is a great question, Paul, because it's really expensive. And so our commitment, or as part of PPOP, when we organize drop-in expungement clinics, we also secured funding to help pay, I think it's the $80 filing fee, which is not insignificant. And I wanted to come back and kind of dovetail on the partnership, because Portland Street Medicine, they have accompanied PPOP on some of our outreach, and hearing Kelsey talk about it, just highlighting that like community partnerships in general we're watching these coalitions of providers and harm reductionists join even more. And so wanted to note that, like, you know, Portland Street Medicine and PPOP can be one angle. We're working with PPOP is working with Central City Concern and Cascade AIDS Project to do on-site testing for HIV and hepatitis C. We got funding from the Alano Club to fund our expungement waivers. And part of it is like both the services, but also the money piece. So find out ways that we can be bringing testing for chronic diseases, and also just get the services and the funding for the services that our people need. And I would love to see mobile vaccination clinics for both flu and COVID-19. So we would like to see that.
Fabulous, fabulous. I want to get a question out to our peers who were so generous with giving of themselves during our presentations here today. This one question came through here. How do you navigate the client's privacy and things like HIPAA with a peer support specialist and interacting with clients or patients? How has that kind of thing come up in the past? Do either of you want to speak to that?
Yeah, so we, especially in Columbia County and Clatsop, we're really small communities. So very often we end up working with people that we know have been around in the past, maybe went to high school with. The great thing about having more than one peer would be that we get that person in to the, right in that first process, and then we're able to pass off that person to somebody we trust on our team, somebody we feel like they may have a connection with.
Awesome. And I think this one, I want to mix this up a little bit as much as I can, friends. Kelsey, you were talking about some training on there that seemed like it really resonated with folks, that people were curious to learn more about. And folks were wondering, how do they get access to that training for their organizations? They thought they sounded particularly awesome, and they were curious about that. Also wanted to find out, as far as training, do you go through any kind of training yourself to protect yourself out of concern for aggressive clients? Any of that you feel like speaking to? It's up to you.
So I'll start off with the idea that our clients are aggressive, which is not the experience I've had. And I will say there are times when people are escalated or might be having a mental health crisis. So our team is trained in like de-escalation techniques and ways of engaging with people. We set up our sites in a way, so a lot of them are outdoors, which immediately is de-escalating because people don't feel confined or trapped. But for our indoor site, we make sure that there's like a safe pathway to an exit for people. They don't feel enclosed. Some people feel safer indoors and some people feel safer outdoors. I've been, working these sites for 10 years and I've never had a situation where I felt unsafe or threatened by anyone. So, not to say things can't happen, but that's just not been my experience. And I see heads nodding that I think that I speak for a lot of people with that. And then secondly, to the more formal training piece that we provide in Multnomah County, we have an upcoming Train the Trainer for Naloxone on March 12th, which, Paul, I sent you the invitation to that. If anyone is interested in sending their teams or participating in that, it's over Zoom. It's 2 hours long, and we get into the nitty-gritty about implementing a distribution program, and for organizations that are in the kind of Tri-County area, we can then sign you up to purchase the nasal Narcan through the Multnomah County Pharmacy. Unfortunately, because our health officer is the one authorizing that prescription, we can only do it for organizations in the Tri-County area. But also, I think I speak for Haven, probably just seeing all of us, we have so many PowerPoint slides and different trainings we've done in the past. And so I'm happy for my email address to be out there. If someone is putting together a training, I will send you slide decks that you can pull from, edit, put together. I can send out my Train the Trainer slide deck too, that you can pull from. Don't reinvent the wheel. The work has been done.
And I'll just let you know, everyone who's been participating in this, putting this program here together today, has been pretty spectacular to work with. So when they say they have resources, believe me, they do. Sorry, I think I just cut someone off.
I was just gonna jump in quick on the training piece. I think that I won't say that I've never had an escalated or violent situation happen in our space, because it does happen and it can happen. It's mostly always been between participants, but having mental health first aid training is really, really helpful. De-escalation training is really, really helpful. Motivational interviewing is also really we talk about like the touchy-feely parts of harm reduction a lot, but the reality of it is we do live in an unsafe world and violence is common. Like I bartended before doing this and I saw way more fights in the bar than I've ever seen in our exchange spaces. So I think acknowledging the reality that people's lives are complicated and hard, and setting up your staff, setting up your volunteers, setting up the people doing this work with tools like mental health first aid, de-escalation is really a really cool thing and a really great way to like engage with people, because they're no more unsafe than anyone else walking around in the world.
Yeah, and just to add, yeah, kind of 2 points, and I'm glad Kelsey and Haven, and I see our peers nodding too, where it's like, often if someone is, you know, might be described as aggressive, it's like, what are the resources that they need right now? And I think about a participant who came to us the weekend that it was snowing, and like a handful of us hiked out to do services in the snow. And we said, what is it that you need? You need Narcan? We got it. You need a burrito? We got it. You need warm clothes? We got those. You need safe for use supplies? We got those. And it was just, I see so many heads nodding where I'm like, great, it's not that a person is aggressive. It's that like a person is being denied the basic things they need just to survive. And so when we're in a place to offer those, watching it, but also, yes, mental health first aid and de-escalation, like knowing when and how to even intervene or approach someone has been one of the biggest things. If they're in an acute like psychiatric event, it's like for everyone's safety, you know, maybe give them some space. And then around the naloxone, train the trainer, like, yes, plugging Kelsey's training. I also like want to point out that people who need naloxone mostly know how to use it. And so our role is understanding it for ourselves, knowing when I approach it is knowing how to talk about it in a way that honors their wisdom and then kind of gets out of their way. So when Kelsey's train the trainer or setting up systems, I just want to highlight that it's like not about how to use Narcan as much as explaining it for maybe like normies, and also understanding how you can set up your own systems to be providing it. And
Awesome.
she's amazing at that.
Awesome. I want to squeeze in a couple more questions here while we still have time. I'm going to throw this one over to, I'm not sure who's going to be best to take this. I suspect it might be, I'd love to hear Dr. Korthas's perspective on this, but how do you balance documenting in a system like Epic substance use and yet respecting the privacy of the client? Does that kind of thing come up a lot? I had a couple questions down that street.
Thanks. What a great question. I think of two things when I think of documentation about substance use. First of all, using the same respectful language in the medical record as we would in person, right? So getting away from just documenting in the subjective portion, you know, addict comes with dirty urine, you know. These are people who are using drugs who have a return to use, or you know, using person first respectful language, and there are a number of resources for that. And then secondly, you know, my hope is that by finally tackling this as a medical community, we're contributing to decreasing stigma by making this just another medical condition that should be documented like any other medical condition. I think the movement toward open charts in Epic is promising with regard to that. And just think about as you're documenting what you'd want the patient to read.
Wonderful. Wonderful. Oyinda, I got one I want to throw your way, friend, in terms of coverage. Of course, coverage questions are going to go to you, right? Can you speak to, does Medicare cover the cost of naloxone when an opioid is prescribed? And then I also had a follow-up to that is like, what's a naloxone kit cost?
Okay, so I think the first question I'm going to focus on for Medicare. So yes, Medicare covers naloxone, and that is also based on the patient's government subsidy that they receive. So I put in my slides for each patient for the generic product for the naloxone, they could either pay between $1 or $4 for the generic product. For the brand product naloxone, which is usually Narcan, they could actually pay between $4 and $9. So that's a range based on whatever subsidy that they're receiving. The good thing about having Medicare also is that, you know, there's no limit to the refills that they receive for their medications, for the naloxone, which is awesome. Now, for the cost of naloxone, that varies. So I said earlier, for Medicaid population, it's totally covered. They don't have to pay. But it's also based on if you do have insurance or you don't have insurance. So like I highlighted right now for our Medicare population, there's the coverage, there's a range of copay they have to pay. So it varies, based on the coverage. But for patients that are covered under private insurance, they could pay between $10 and $20 for private insurance. So that's that range.
I got one more question I want to piggyback on that with, and I couldn't even begin to know how to answer this question. But if you've only gotten naloxone in like spray form, right, and the person isn't breathing, is there still an effect to administering the naloxone?
Okay, so the question you have to understand is that when you give naloxone, it is a shock-acting medication. So the recommendation is that you give naloxone every 2 to 3 minutes if the opioids the naloxone begins to wear out. So you want to be aware that's why you want to also call 911 immediately when you are in a situation whereby a patient is actually in a situation of overdose situation. So you want to immediately call 911. And if you notice within minutes that the patient is actually experiencing that overdose experience again, immediately you give naloxone within 2 to 3 minutes intervals. And that's why, and they recommend you give it in the different nostrils. So that's very important to take into account.
Well, friends, panel, I'm here to tell you, I wish we had like 3 times as much time as we have here today to spend with you, because the audience is super hungry to spend time with you. And I suspect a lot of people are going to be wanting to email you. So I hope it's okay that we share some of your contact information beyond this. Justine looks like she's ready to go. She's like, please email me. But I just want to thank you all before I say bye-bye and make you sever your camera connections for your incredible generosity of spirit and insight and knowledge. That you've been phenomenal, and people are just really moved and thrilled to be able to get the knowledge and time with you that we did. So I'm going to say bye-bye to our panel, and I'm going to say a few closing words to attendees today about CME and all those other exciting things that you have questions about. Just to let you know, of course, this entire slide presentation and video will be coming out to you along with additional resources next week. Later this afternoon, I'll be sending out an email to everyone who registered in Eventbrite with a couple of links to different surveys, both regular CME credit, which will also be applicable to folks from the Oregon Board of Pharmacy, or if you're an LCSW or similar occupation, you use CEUs, there's a specific survey for that. If you don't receive the email with all these links, just email me directly. There's my email on the screen there, and that's perfectly fine. But you should get it if you enrolled in Eventbrite. If you don't, of course, check your spam filter, or your junk box, and you'll find it in there. But we'll make sure you get your credit certificates one way or another. That's my guarantee. But this was a very popular course here today. On this next slide that we have coming up here, you're going to see that we have all of the presentations, including the one that we are doing here this morning, captured on video. So if you want to share what you experienced here today with your peers and colleagues, you can just go to our MedZed webpage where we have videos of all of these. I think we have over 20 MedZeds that we have there now for you folks, but there's no password or any kind of access needed. These are just public domain things that you can share with your peers anytime you like. We're constantly adding to this page of resources. In conclusion, we found that on this next slide, you'll see that we have other things in development. I don't have dates for the next upcoming MedZed yet, but you're going to be seeing these in Q3 and Q2 of the next year. The one on clinician and team wellness seems to have really struck a nerve with folks, given how many disasters and stressful anxiety events we've experienced as a culture here in Oregon and beyond this year. So expect to see that and news on registering for that coming up soon. We're also going to be focusing on community health workers as well. There's a lot of development. You are a fantastic audience. You are always here, and you're always willing to engage in a positive way with our presenters. I wish we had more time to do that here today, but I just want to thank you for spending your time with us here today at Care Oregon and MedZed. And in particular, thank you for all of the incredible work you do for so many people in the state of Oregon during some of the most challenging times we've ever experienced. So we are super grateful for you. Everyone stay safe, and thank you for your time. We'll look forward to spending more time with you again soon. Enjoy the rest of your day. Thank you, friends, and goodbye.